How to identify a nickel allergy rash. Have you ever noticed a rash after wearing certain jewelry or touching metal objects? You might be dealing with a nickel allergy rash. This type of rash is a form of allergic contact dermatitis. It happens when your skin comes into contact with nickel-containing items. The reaction usually occurs between 12 to 72 hours after exposure, which can make it tricky to connect the dots. So, what should you look for? First, pay attention to the itching. This rash typically causes intense itching localized to the area where the nickel touched your skin. Common spots include areas where jewelry, belt buckles, or zippers make contact. Next, observe the color changes. You may notice redness or other changes in skin color around the affected area. The rash can also present as small bumps or raised patches. In some cases, the skin may become dry, scaly, or rough, resembling a burn. If the rash is more severe, you might see blisters that can ooze fluid or cause pain. The skin may feel warm or tender, adding to the discomfort. If the rash persists, it can lead to thickened or cracked skin. Unlike irritant reactions, which can happen immediately, a nickel allergy rash is immune-mediated. This means it can last from 2 to 4 weeks after contact, even if you remove the nickel source. To confirm if you have a nickel allergy, a healthcare provider may suggest a patch test. This involves placing small amounts of nickel on your skin under patches to see if a reaction occurs. To identify a nickel allergy rash, keep track of when the rash appears. If it shows up after wearing or touching items known to contain nickel, that is a strong indicator. Common items include jewelry, watches, eyeglass frames, coins, and clothing fasteners. Pay attention to the timing of the rash. It typically appears hours to days after contact. Look for characteristics typical of allergic contact dermatitis: itchy, red, scaly, and sometimes blistering skin. If you suspect you have a nickel allergy, it is wise to consult a healthcare professional for a proper diagnosis and possible patch testing. Recognizing a nickel allergy rash is essential. Once you are sensitized, the allergy is lifelong. The best way to prevent reactions is to avoid nickel exposure. Treatment focuses on relieving symptoms and steering clear of nickel-containing objects. In short, a nickel allergy rash is an itchy, red, and sometimes blistering reaction that develops in areas exposed to nickel. It typically appears within days after contact and aligns with allergic contact dermatitis.